Our bodies are incredible machines, equipped with an innate ability to heal. When we experience an injury, our body sets into motion a complex cascade of events to repair the damage. This intricate healing process involves multiple stages, each playing a critical role. Understanding these stages can empower us to optimize our healing potential. The first stage, the inflammatory phase, begins immediately after an injury. Redness, swelling, pain, and heat are signs your body is working to heal. Blood vessels constrict to minimize bleeding, then dilate to allow white blood cells oxygen and nutrients to the site. These components fight infection and provide building blocks for tissue repair. The inflammatory phase sets the stage for repair and regeneration. Remember, inflammation symptoms are positive indicators of healing. If you found this information helpful, please like, share, and subscribe to the Diseases and Cure channel for more insights. The initial 72 hours after an injury are critical for setting the stage for optimal healing. During this acute phase, the focus is on controlling inflammation, reducing pain, and protecting the injured area from further damage. One of the most effective strategies during this time is the widely recognized RICE protocol. RICE stands for rest, ice, compression, and elevation. Rest involves avoiding activities that put stress on the injured area. Ice application helps reduce swelling and pain by constricting blood vessels. Compression, achieved through bandages or wraps, helps limit swelling and provide support to the injured area. Finally, elevation, particularly for limb injuries, helps drain excess fluid and reduce swelling. In addition to RICE, over-the-counter pain relievers like ibuprofen or naproxen can help manage pain and inflammation. However, it's important to consult with a healthcare professional before taking any medication, especially if you have underlying health conditions or are taking other medications. Remember, the first 72 hours are a window of opportunity to significantly influence the healing trajectory. By diligently following the RICE protocol and seeking appropriate medical advice, you can effectively minimize inflammation, reduce pain, and pave the way for a smoother and faster recovery. As the initial inflammatory phase subsides, typically within a few days to a week, the body shifts its focus towards repairing and rebuilding the damaged tissues. This phase, known as the repair and regeneration phase, is characterized by a remarkable cascade of cellular activity. One of the key players during this phase is a protein called collagen. Collagen acts as a scaffold, providing structure and support to the healing tissues. Fibroblasts, specialized cells involved in tissue repair, migrate to the injury site and begin producing new collagen fibers, gradually weaving a network that bridges the damaged ends. Simultaneously, another critical process called angiogenesis takes place. Angiogenesis refers to the formation of new blood vessels, which are essential for delivering oxygen and nutrients to the healing tissues. These newly formed blood vessels provide the necessary fuel for the energy-intensive process of tissue regeneration. The repair and regeneration phase is a testament to the body's remarkable ability to heal itself. Understanding this phase can help you appreciate the importance of providing your body with the necessary nutrients and support to optimize tissue rebuilding and regain strength. Section 4. Remodeling and Recovery, the final stretch. The remodeling phase, also known as the maturation phase, is the final and longest stage of healing. This phase can last for several months to even years, depending on the severity of the injury. During this time, the newly formed collagen fibers continue to reorganize and align themselves along the lines of stress, gradually increasing the strength and flexibility of the healed tissue. Think of it like this. Imagine a newly constructed bridge. While the initial structure might be in place, it takes time for the concrete to fully harden and for the bridge to withstand heavy traffic. Similarly, during the remodeling phase, the newly formed tissue gradually gains strength and resilience, allowing it to handle increasing loads and stresses. Physical therapy plays a crucial role during this phase. Targeted exercises help improve range of motion, flexibility, and strength, gradually restoring function to the injured area. Your physical therapist will guide you through a personalized exercise program designed to challenge your body and promote optimal tissue remodeling. The remodeling phase is the final stretch on the road to recovery. By gradually increasing the intensity and duration of your activities, you can help your body adapt and rebuild stronger than ever before. Section 5. Factors influencing healing: time, age, nutrition, and more. Several factors influence the speed and efficiency of the healing process. Understanding these factors can optimize your recovery. Age significantly affects healing time. Children heal faster due to a higher metabolic rate. Older adults produce less collagen, slowing healing. Nutrition is vital for tissue repair. A diet rich in protein, vitamins, and minerals supports cell growth. Staying hydrated is essential for nutrient transport. Chronic conditions like diabetes can impact healing. These conditions impair blood flow and immune function. Certain medications can delay healing. A positive mindset aids recovery. Stress and anxiety can interfere with healing. A positive outlook can improve healing outcomes. Healing is influenced by health, lifestyle, and mindset. Adopt healthy habits to support optimal healing.